Hello everybody.
Hello.
Hi YouTube friends. We are coming at you live from, show them your shirt, honey. Give me your sweatshirt.
Kansas City.
Kansas City. Ann's sister lives here, and so we came out for a visit.
It is beautiful.
It is beautiful. We had to get these
Flowers in the background,
picture.
and tulips and everything else.
We're under some big trees in our front yard here, so
And it's so green.
it's a nice time here in Kansas City. But we wanted to give you a little update. So last week, Ann had her first appointment for the new clinical trial that she's starting.
Yep.
So we got to go to our happy place over at Banner Alzheimer's, see our friends, have our delicious lunch together.
Yes.
Panera bread lunch, so that's always wonderful. We got to see our friends there, and so that was great. And so if you saw the previous videos we did, the last time we went in to start a clinical trial, we thought we were about to start it, but we went through all the paperwork to get it going, and then one of the first steps that you do that day is Ann takes an MMSE, which is the standard cognitive exam or whatever. And so that's the standard they use for qualifying for the exam in terms of what level of Alzheimer's are you targeting with the clinical medication. And that's also sort of the standard, measure of how things are going cognitively, I guess. And so when we went in and did that last time, Ann wound up scoring lower than she had previously. And she had previously been around 22, I think, on the MMSE, and on that visit she scored a 19. And a 19, just based on the way that they measure it, put her into the moderate Alzheimer's range instead of the mild. Yeah. Which that medication was not. It was only targeting mild, and therefore Ann didn't qualify for that medical trial. Along with qualifying for the medical trial, there's also just a feeling of, oh, that's a little bit of a dip, in that MMSE score. So anyway, we were all disappointed that she couldn't do that clinical trial. And so the next one that they got us set up with targeted both mild and medium way. I'm spacing moderate. There, thank you. Moderate. And so that way, wherever she scored wasn't going to be an issue. So we went in last week to get that clinical trial up and running, went through all the paperwork, and Ann did her MMSE. And lo and behold, on this MMSE, Ann, they said, oh, she did fine on the MMSE. And I asked, well, are you allowed to tell me? Because sometimes with the clinical trials, they won't let you, they won't tell you results or that sort of thing. Yeah. But they were okay with telling us. And Ann got a 23 on this MMSE. And
Maybe it's because we're in Atlanta.
We're not in Atlanta, we're in Kansas City.
Yeah.
And that was not where we were for the clinic. Well, anyway, we were in Phoenix. But what the heck, So that was interesting. And so, she got a 23. And so we don't, these things can vary. That's why you want multiple, whenever you're trying to assess something, you want multiple data points to get a good feeling for it. But that was a little surprising. And so we kind of joke when Ann goes in for these she knows she's going to have an MMSE. We review some of the things so she can do as good as she can do on them. Like, okay, what's the date today? And what month is it? And what season is it? Who's the president right now? Who's the vice president?
We're ready.
What's the, what city are we in? We did that like we always do. It wasn't anything. There's a lot more to the MMSE than those questions, but but anyway, so she did really well on it, and so we'll take it.
Yep.
And so and I think so that was all good. So we're set up on the new clinical trial. It's something with Merck, I don't know. It's something that's supposed to work in conjunction with one of the medications she already takes, donepezil, which is, if you have Alzheimer's, someone who does, that's a pretty common medication used to help. It helps to moderate some of the symptoms of Alzheimer's. It's not like a cure for it or that sort of thing.
Right.
So it's pretty common. Pretty common medication prescribed to someone with Alzheimer's. And so this clinical trial somehow works in conjunction with the donepezil to help, and again, the mantra is slow, stop, or reverse. Any of those are great goals for Alzheimer's medications and such. So that's sort of where that's at. So she hasn't started the medication yet. It was like the clinical trial got underway, but she still has to get an MRI, and they already did like blood work and some other stuff like that. So anyway, so that's great. And so at some point we'll get a call here soon to come back in, and we got to schedule that MRI, and then she'll start the medication, which is just a pill. So easy peasy in that sense. So that's just all really good news and encouraging, and we're grateful to be part of that trial. So so meanwhile, what do you think about Kansas City, dear? So we've been here a few days.
Amazing. It is so beautiful. Oh my gosh, it's so green. Just lush and old trees and huge, just beautiful. There's like these fuchsia trees and just, can't believe it. All these tulips. It is just a wonderful place. Just feels so good.
Yeah, we've had a really nice trip here.
Yeah.
So we're staying with Ann's sister, Susie, and we're here in town. They also have a small farm, and so we got to visit the farm for a little bit and have dinner there with her husband. And we went to church out here with our sister church in Kansas City and had a great time. And, we've just gotten to eat a few fun places and do a few fun things. It's just been a great trip. So we've definitely enjoyed our time here in Kansas City. So we'll be heading back to Phoenix soon, but we miss our dogs.
Yes, they miss us.
Little Peanut and Buttercup. My mom's taking care of them for us, but we've had a great time here. And so anyway, that's kind of the latest. I guess we'll just keep you posted on how the clinical trial's going, and had a couple of ideas for just some other fun little short videos, so we'll work on those. But appreciate everybody following along and praying for us, thinking of us, and for our family and friends and people we don't know yet out there in YouTube land. Thanks for watching, and hope you enjoy your day today. And we'll look forward to catching up with you again next time. Bye.
Bye.